morning, everyone. Happy Sunday. So today, as requested, I am going to be speaking on corns and calluses, actually. This will be built. So this is a picture of some ugly things that a lot of us, especially women, don't want to see on our feet. This is what a corn looks like. This is what a callus looks like. And I'm going to go a little more into that as I go along. So what are corns and calluses? So corns and calluses are a buildup of hard, thick areas of skin. Although these hardened areas of skin can form anywhere on your body, you'll usually see them on your feet, hands, or fingers. Corns tend to be small and round. You're most likely to see those on top or sides of your toes. The calluses are hard, thick patches of skin compared with corns. Calluses are larger and have more irregular, more spread out shape. You're most likely to see calluses often on your hands, the bottom of your feet, and on bony areas that carry your weight. So your heels, big toes, the balls of your feet, along the side of your feet as well. So what are the symptoms of corn and calluses? Corns and calluses have many distinct features. Corns look like small, round, as I discussed earlier, raised bumps of hardened skin surrounded by the irritated skin. Raised areas of bumps that may be painful or cause discomfort. The calluses, as I discussed earlier, is thick, hardened, larger, and typically more flattened patches of skin, less sensitive to touch than the surrounding skin. Both corns and calluses can cause hardened areas of your skin areas. There is repeated friction or pressure on that skin area. Pain, redness, and blisters can also occur. What are the causes? Corns and calluses have many of the same causes. These include shoes that don't fit properly, standing, walking, or running for long periods of time, physical hobby, sports activities, or work labor that puts pressure on your feet and or causes repeated friction on an area of your skin or hands and fingers. Going barefoot. I know a lot of people feel that it's okay to connect with the earth and go barefoot, but these things can also cause this on your feet. Not wearing socks with footwear. Having socks or shoe linings that slip or bunch under. So you see sometimes if people may be wearing the socks and you're running and walking and it just goes under your feet, that's not good also. Walking with improper posture. So walking too heavily on the inner or outer edge of your feet. And structural foot deformities or changes to the shape of your foot can cause this as well. So who's more likely to get the corns and calluses? You're more likely to develop corns and calluses if you already have medical conditions that change the normal alignment of the bones in your feet. For example, arthritis in your feet, bunions, bone spurs, and hammer toes. You walk without socks. You wear shoes that are too narrow for your foot. You have atrophy or loss of your natural cushioning padding. A healthcare provider can diagnose corns or calluses by looking at your skin. So no tests are really required for this. Just a simple visual exam of your skin is usually all the provider needs. So how do you manage and treat to remove these corn and calluses? Treatment depends on your symptoms and what caused the corn or calluses. But for the typical corn or callus, removing the buildup of skin is an effective treatment. So here are some steps you can follow. Soak the area with the corn or calluses. Let's use some foot, for example, in warm water until the skin softens, usually 5 to 10 minutes you want to soak. Wet a pumice stone or emery board. While the skin on your foot is still soft, gently move the stone or emery board across the corn or callus to remove the dead skin. Don't be rough. Just take your time and slowly do that. Continue to file down the corn or calluses, moving the stone or board in one direction, or if you're going to go across, just go slowly doing it. Be careful, don't remove too much skin. This could lead to bleeding and an infection. Apply a moisturizing cream or lotion to the corn or callus and surrounding dead skin every day. Look for products that contain urea or ammonium lactate. These ingredients will soften the skin over time. Management continues. So surround the corn or callus with donut-style adhesive pads. A lot of the pharmacy stores, you can buy those little tiny little pads. They're round and inside of it has a little cutout, just like a donut that can be used. Wear properly sized and shaped footwear. Ladies, I've been guilty of it as well. We like to wear nice, pretty shoes just to look pretty going outside. And sometimes they're uncomfortable. Don't do that anymore. Try not to do that anyway. Wear properly sized, shaped footwear, as I discussed. Keep your toenails trimmed. If your corns or calluses are painful, apply a cold pack. Never try to cut out. Don't try to treat corns or calluses if you have diabetes. You want to have it, or if you have poor circulation, are not prone to infections, or have delicate skin. This particular population, I want to employ you to see a healthcare provider to check that corn out. A reminder, as corns and calluses are the result of friction, irritation, or pressure against your skin, they can return at any time also. If you haven't addressed the cause, they will definitely come back. In other words, if poorly fitted shoes were the cause and you continue to wear those same shoes, the corns and calluses will likely return. You can successfully manage most corns and calluses at home with a little care and attention. If you're concerned about the growth on your foot, see a healthcare provider. They're in the best position to examine your feet, ask about or test for other medical conditions you may have, treat your feet, and advise you how to take care of them. Those shoes may look cute, but if they're too tight, you shouldn't wear them. You could develop a corn or a callus. If it's too late and you already have one, the good news is most corns and calluses aren't serious. You can typically treat them at home, but if you have diabetes, as I stated, or any other underlying condition that increases your risk of infection, please see a healthcare provider for treatment so that it does not get worse. I want to give special acknowledgement to the American Academy of Dermatology Association, the Mayo Clinic, Cleveland Clinic, and allcarefoot.com for the information that I provided to you today. I hope this was helpful. Should you have any questions, feel free to join me in the Zoom room immediately after service, and I'll be happy to answer them for you. Thank you so much. God bless and enjoy the rest of the service.